Welcome again to Reflections on the Community and its Cultures. This time around, we'll take a look at a hospice program and we'll welcome a still fairly new minister to the community. Later, Edie Vernon and June Adams will talk to us about the Hynes Memorial Hospice program. First up, the new, still fairly new minister at St. Andrew Catholic Church will talk about his parish and the activities there. That's coming up on Reflections. Reflections continues now as we welcome to the program June Adams and Edie Vernon.
Hello.
And
hello.
Welcome to the show.
Thank
You're
you.
nice enough to wear your name tags, but my eyesight doesn't help me, and so I have to write little cues to myself who you are. You are connected with one as an RN and one as a social worker with Hynes Memorial Hospice.
That's correct.
Okay. Who wants to do the hard job of sort of giving us a thumbnail sketch of what is a hospice?
Hospice services are a specialty area in healthcare. Just like you have cardiology and nephrology, you have hospice. And our service is dedicated to serving people who are facing a life-threatening illness. And it was originally designed under the Medicare benefit for the last 6 months of life.
Oh, really?
But now third-party insurers also have hospice services available, and so we serve a variety of people facing life-threatening illnesses.
Okay. And your job is, your job is as a nurse?
Right.
Okay. And your job is as a social worker?
Yes.
And again, those two things are extremely important in that goodbye period. That
Very much so.
That everyone faces. Not many of us think about it, even those who are in the midst. It's hard to think about. And I assume that's kind of part of your job, is to help us get a handle on that. And how do you do that?
Well, we look at how people are functioning within the parameters of their illness, and what our job is actually to maximize their functioning. So as a nurse, I would look at the physical aspects of that, and we would try to enable people to enjoy their family time together by relieving pain. We try to make sure a person's free of nausea, vomiting, shortness of breath. But I need my coworker to help me with,
let's put her
things,
to work. Let's put
other
her to
things,
work
other things.
Yeah,
yes.
because beyond health, beyond medication, there is the beyond, isn't
Right.
there?
As a social worker, you know, you look at the patient and the families as one unit. And so it's very important to provide the support and needed resources. There are many times that families need additional support in the home. And as a social worker, we look at the community resources to find what's best for them and works best for them. We have volunteers that are wonderful and educated and are extremely helpful with families when maybe their extended family lives away from where we're serving them.
Yeah. And again, it means something different, I'm sure, to every single individual that you deal with. And for many people, it means some very difficult things for them to think about and for them to physically deal with. So you've got it kind of coming from two angles here, two important angles. Yeah, you were about to say?
Yes, I was going to say we certainly don't want to leave out other team members. June mentioned volunteers, but we also provide spiritual care through our chaplain services, and we provide nurse aid assistance. We actually have nurse aides who help people with their daily activities of living, such as bathing and those kind of things. So we work as a team, and we don't want to leave out our medical director either, because we meet every 2 weeks as a team to discuss our patients, and our medical director gives us a lot of input.
Right. To get real specific here, and then we'll come back to dealing more with the meat and potatoes of what you're up to. The Hynes Memorial Hospice is where?
We have offices throughout southeast Kansas. Our main office is in Wichita, but we have local offices in Coffeyville, Parsons, and Pittsburgh.
Why does someone seek you out?
I think the first thing is physical comfort. They are facing pain, or they're facing stress, anxiety, and that is usually what directs them towards us. We're a specialty service, and a lot of people think we mostly treat cancer patients, but that's not true. We treat a lot of people with end-stage disease such as congestive heart failure, or end-stage renal failure, or muscular dystrophies of the various types that are out there. And so when people get into a crisis, that's usually when a doctor or a nurse will say to them, have you ever thought about hospice?
So that is kind of the, for many people, kind of the initiative that happens there is a discussion with a doctor type person or a nurse.
Or they'll think about it at home and they'll call our office wanting to know, because they've heard from a friend or neighbor that we have a wonderful service.
And I think it's very important to let them know if there's any questions at all, even if they just want to know a little bit about hospice, just to give us a call.
Okay, cue. A call to what number, pray tell?
Pray tell. It would be 1-866-865-2154. That is a toll-free number.
Okay, and that will connect you with the hospice program, and you can get some answers, but more importantly, you can find some avenues to explore those answers. A lot of people, you've given me some notes, and most of them I'm ignoring, of course, because that's what I do.
That's okay.
You've given me some notes here. Many people think, hospice is a place for dying. And you have a statement here that says,
No.
Hospice is what?
A place to maximize your life.
Right. And the fact that it is probably the last chapter of your life does not mean that it's, well, it's all bad news, but it's not as bad as some people might think. Is that fair?
I think that when you're in hospice, you have a strong faith base. And when I talk with my patients, and June, probably you as well, the question is always, are we doing this right? And there's no right way to die, but they are asking for support in what they feel is important to the end of their life. And so we try not to put any judgments onto that, because every person has different things that they need to do at the end of their life.
Is there, you mentioned that very often a referral or encouragement will come through the healthcare system. Have you considered hospice? How do you qualify for, how do you know you ought to be talking to you folks?
One of the things that's a confusing thing actually is that the doctor has to sign a certification that you're facing the end of your life, and the doctor will say that in his best or her best knowledge, this person is looking at the last 6 months of life.
Okay.
Now, however, the average length of stay in hospice is more like 2 weeks.
Really?
And so that tells you right there that people in general delay getting hospice services.
Okay. So somebody gets involved in the hospice service. As a social worker, again, you may be looking at a couple of weeks with this person. You may be looking at a couple of months with this person. How do you start?
You start in there. You start where the family's at. That's where you start. You go in, you talk with them, get familiar with the family. It's very helpful, the caring piece that you bring in there, because that allows the family to open up and really ask for the support that they need.
What kind of support? Again, I know that's a silly question because it's so huge, but dumb it down for me.
As I mentioned earlier, we talk about hooking up to resources. That is extremely helpful during this time of their lives. I provide counseling, support to the families at any age. It goes from children to elderly. Just let them know that they have someone they can talk to. Just let them be able to express how they're feeling at this time of their life.
Because I'm sure as they face this big event, not many people want to talk about it. To them, to me. I feel, I'm in need of your service. And I'm probably not going to find many of my friends who want to talk to me about that. Oh, no, you're fine. You know?
We are a safe place to talk about it because it's expected that we would talk to folks about how they're dealing with their illness or whatever has brought them to us. I think that folks in general have become more open since when I first started in hospice. I think that most of the people in this area have heard about us in some way, shape, or form, but every once in a while I'm astounded at what they've heard. There's a lot of fallacies out there, myths and rumors about hospice, and so if you really are looking for some services along this line, then the thing to do is call and find out for sure, because rumors abound.
Yeah, and that call, again, that initiation with the hospice service, that doesn't mean, okay, come in here, this is your bed now.
That's right.
Right. You know? Right.
I have in the past helped prepare people to go on the last cruise of their life, how to handle medications on the cruise and how to make those arrangements, and you know, remind people, well, you better take this, this, and this in case this happens while you're gone, and sent people off on their big cruise of a lifetime. Or we help people move. I mean, sometimes the situation demands a change in location, so we have done that. My social workers have done everything from sipping tea, sitting and visiting with people, all the way up to one time we had a family that really needed Habitat for Humanity to come in and help make the home suitable to live in. So, I mean, you have a problem and you're on hospice service, we look to see what we can do. Now, some problems we can't solve, but and
some problems,
but we can help.
Help
get through it, if nothing
assist,
else.
You know, and again, you're looking at very much a kind of a final chapter for most of the people you deal with. In 15 or 20 seconds, how do you deal with that? I
personally find that my patients have strength, and so I have strength for them. And then my faith in Jesus is very personal faith that keeps me through the storm.
I would have to agree with Edie. You know, your personal faith really.
I just knew she'd say, well, what she said.
But I also know for me, for myself, I try to take care of myself, and I try to incorporate exercise, because even though that you really want to help families and make sure they're taken care of, you also have to take care of yourself.
June Adams and Edie Vernon with the Harry Hynes Memorial Hospice. Again, offices in Coffeyville, Parsons, and Pittsburgh, and also Wichita for the big office. If you want information about it, best initial way to find out is 1-866-865-2154.
Correct.
And we thank you very much for your time. It's a topic that I don't think we've discussed on the show before, and we ought to do it every once in a while. Maybe we'll have you back again.
Thank you.
Thank you.
All right. Thank you for joining us for this edition of Reflections.